So, if you ever had the experience where you go to your healthcare provider's office, you're going for your annual physical, this is supposed to be free, right? If you have insurance in the United States, they don't cover pretty much anything, but they are at least supposed to cover an annual physical for you. And if you have, if you go to a gynecologist, anything like that, that's also supposed to be covered as well, right? So, you go to this appointment, you come back, and all of a sudden, like 2 weeks later, you get a bill for like $175. And you're like, whoa there, friend. This was supposed to be free. And you call the office back and they say, oh, no, 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 no. That is actually not going to be free because you mentioned that sometimes you are having trouble sleeping. We didn't do anything about it, but you mentioned it. So now you have a $175 bill because you brought up something else that wasn't technically related to your physical. And you're like, well, she asked me, how am I? And I said I was having a hard time sleeping. And you have a bill. Have you ever experienced this? Let me know in the chat if you have experienced it. Whether you're watching live, hello, live people, or on the replay, hello, replay people. Today, we're going to be discussing why that happens. If you're new, welcome. I'm Liz. I'm a family nurse practitioner, and I am one of the reasons I left primary care, where I was a primary care provider, was I was sick of how stupid it is that I couldn't ask people things or chart things related to that weren't necessarily perfectly fitting into this is a physical like a comprehensive wellness check. And I would have to warn them and be like, hey, we can't actually talk about this. So when I say how are you, don't really tell me how you are. So that got me so mad, along with so many other things. If you've been here, so many other things. There's a whole playlist of healthcare, why we need to change it. But today we're going to be talking about this particular issue and what you can do to kind of avoid it. And just so you know that it exists, so that you don't fall into this trap and get a bill later. Also, you can always, we'll give you some tips along the way of just kind of like, you can say this instead of that to hopefully, present it in a way that we don't have to deal with it. So let's just start off right from the beginning with number one. You cannot mention absolutely anything, right? Okay. Anything other than anything is wrong with you at your regular routine checkup, right? Because as soon as you mention anything is wrong, if you chart it as a healthcare provider, it is going to require you to put in a diagnostic code. So when you're charting in a system, you can't just write in the note, my patient has trouble sleeping. Fun fact, because all it wants to know if you're there for your physical is like, have you had your colonoscopy? Are you exercising? Have you gone to the dentist? Have you gone to the eye doctor? Is anything weird, lumpy, bumpy, hurt, anything like that? And if you answer yes to these, goodness gracious, if you answer yes, we are going to have to document that, right? Because that is someone's job, right? However, you can't just write, yes, there were issues. You have to talk about what the issues were, which then requires a diagnostic code, right? Okay. We're going to be talking all about what diagnostic codes and everything like that is. So just so you know, when you go to the healthcare provider's office, if you mention anything else outside of this, they can bill you for an entire appointment if everything is not perfect, because then you technically have a diagnosis, and healthy people at their checkups shouldn't have diagnoses per our healthcare institution. So I have a TikTok that we're going to watch that outlines this really well. We'll respond to that. We can answer any questions and just kind of go over what this looks like in general, how to kind of get around it, avoid it if you need to. You can't really avoid it, but what to definitely not say so that you don't get surprised with a $75 bill when you just went in for a checkup. Okay? We're going to do this. It's going to be fine. We're going to get you through here. Ready, set, go. All right, night shift. Welcome, friends. Let me know, everyone in the chat, how you are doing today. Jason Stewart, I'm so glad that you finally caught a live too. That's excellent. This mama nurse, hello, welcome. They've done this to my mom many, many times. It is infuriating. Ridiculous. The first time I realized this as a primary care provider, I walked in and I had no idea, because they don't teach you about this in school, right? They don't teach you about that this is something that exists. So someone came in for a physical, they had lots of concerns, and I dared ask them literally how their blood pressure was, because they also had high blood pressure. So I said, like, how's that going? Is your medicine fine? Like, no side effects from it? Your blood pressure, they checked it at home. I was like, hey, has that been going okay? And they also had like high, let's say they had high cholesterol. And I was like, oh, like, how has that been going too? No issues with the medicine, nothing like that. And I just documented it like, hey, everything's going fine there. Blood pressure is totally fine at home. And guess what? I was surprised when they came back, called back, and they were irate. And I was like, oh, hi. Like, they're like, I got charged for that visit. You said it was going to be free because people usually ask you, they're like, and just to make sure, like, this is going to be covered, right? This is my annual physical. I was like, oh, yeah, it's your annual physical. Well, that's when I learned. I called our biller and she was like, well, no, you talked about their blood pressure. I was like, well, it was their physical. Like that was part of the things we talk about was like, hey, is everything going okay? And she was like, no, 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 no. If at a routine wellness visit, you mention anything that is wrong, whether it is a chronic problem that you've had for a long time or something new, you can charge that as an entirely new visit, which is what most people do when you go to the healthcare provider's office and you're there for your physical, but they also are going to bring up these other things. And it's going to be double billed. So they basically get 2 for 1. They get paid for both. They get paid for an acute visit and this. It's not evil a lot of the times on the part of the provider because a lot of people are like me and they aren't even totally sure. Not in all offices are you as the healthcare provider the one that bills for things. So let us take a brief moment and discuss what it looks like from a healthcare provider's end when you actually go to bill for things in case it's interesting to you and you would like to know because I certainly didn't know before I went into this. So on my computer screen, when say let's you came into me and you were my patient and you had high blood pressure, you were coming in for a physical. So I type in, like I said, all of those things. And then under each, it's called under your assessment and like treatment tab. Under your treatment tab, it would be like physical, like comprehensive physical exam or whatever, annual physical exam, wellness exam. And you would write under it how that went. Hey, it went fine. I gave them the order for their colonoscopy. They are going to the dentist. I told them to keep doing that, keep, eating their balanced diet, yada, yada, yada. All of the things that you told these people you have to document. And you do that under what's called a diagnostic code. So for a annual wellness exam, it's Z00.00. If there's something wrong, it's like Z00.01. There are a bajillion ICD-10 diagnostic codes, right? And everything you write into a chart needs to have this diagnostic code so that it stays organized and they can bill you for it. Because remember, in our country, healthcare is a product. So basically, this is your product bar scan saying like, boop, we talked about that. Boop, we talked about that. And the more boops you get, the more things that you can diagnose and put as a treatment code, the more money you are going to be able to get because we have different shopping carts in healthcare. Okay. We have the shopping cart for the free stuff, right? That's over here. It's very small. There are very, very few diagnostic ICD-10 codes that fit in this shopping cart. Okay. And that when they come to the checkout, they see this shopping cart and maybe it's green and they say, oh, you don't even have to pay. It's a green shopping cart. So why don't you pass right on by? You get to just go. Don't worry. Your insurance covered this visit. Bye-bye. However, oh, there better not be nothing else in that shopping cart other than Z codes. If they don't start with Z, they can't be in the green shopping cart, allowing this visit to be free, right? So let's say someone talks about their blood pressure. Well, their blood pressure is I-10. I-10 does not start with Z, my friends. So you bring it in and if you write anything in the chart, and I mean anything in the chart about this person's blood pressure, you then have to chart it under in treatment I. So you have to write you pull it up and you're like, oh yeah, we talked about their blood pressure too. And I'm going to write about, they've been checking it at home. Their blood pressure has been totally fine. They're taking these meds. Everything is good. So let's just go. Okay, let's go. That goes into a new shopping cart. And the shopping carts from here on out are going to be how you are billed, right? So we have a 99213, that holds about 3 items in it, 2 or 3 items that are pretty simple. If you have more than 2 or 3 diagnoses that you're working on in this visit, you have to get a bigger shopping cart. That's 99214, and that's going to cost you about $75 more. Now, heaven forbid, you have even more going on or more time was spent or you have more diagnostic codes or we do a procedure that might go into a 99215 shopping cart. And those are very expensive shopping carts. And that's a lot. There are other shopping carts, but those are our basic ones we use in primary care and they all cost different amounts. So when you bring something else up at your physical, they might be adding one of these other shopping carts to your little green free shopping cart that went right out because you happened to bring something else up. And the really nasty part about this is if you have a biller or a coder in your office who chart like goes through your chart, they are for sure going to tack on the other shopping cart because in the beginning, I actually got in trouble because I was documenting under like here's my physical exam and then here's their blood pressure, here's their cholesterol, here's their diabetes. I was documenting all of under those, but I just didn't charge them for it because I was like this is stupid. I hate this and I think this should be covered anyway. And I did that until I got in trouble and I was told that could be fraud. So I was like, oh, well, I like my patients and I'm all about trying to save them money here, but apparently I can get in a big trouble for just pretending that other shopping cart does not exist. So if you are in an office and they ask you something else, like, how is everything going? It is actually completely fine to literally say, I like, am I going to get charged if I tell you anything? Essentially, if they're going to document it. I have had patients tell me that all the time and just ask, be like, hey, I know my annual physical is covered, but I don't want to talk about this in case it's not covered. And they might say, hey, let's hear about it first. Okay. Which is what I would do. I would usually tell my patients, like, hey, why don't you tell me what it is? If it's something that I feel like we don't have to write in the chart, which this is illegal, don't do what I'm doing, don't do as I say, not as I do. But hypothetically, this is what I would do is say, just tell me about it. I'm not going to chart it. Okay. Cause if I put it in this stupid chart so that I remember it the next time I see you, then, then I have to document it and then I have to charge you for another appointment. But if we just have a hypothetical conversation, right? If we have a hypothetical convo and you're like, if I were to have allergies, if I were to have those, what should I take? And I hypothetically say, well, if I was happening to be in Target in the aisle next to you and I was recommending something, I would probably recommend this. Again, don't do this. This is not official legal advice. And that's how I would proceed with that. If you have a cool healthcare provider, they might do that. And then when they come back in for like a routine check in, that's like every whatever 6 months, I want to see my uh, patient because they have a couple things going on and I just like to check on with them and that visit they expect to be paid and then they might be like, hey, remember I did start this allergy medicine. I've probably forgotten that they've mentioned it to me at that point and they're like, I'm like, oh wow, that's a great choice. They're like, yeah, remember you told me to do it. And I'm like, oh yeah. Then you can add it back into the chart and everything is hunky dory. But please, 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 please ask. Okay. Just ask if they just ask, guys, ask if they are going to charge you for this because a lot of places will not tell you. And I think that's super skeezy. And that is either skeeziness on the part of the office who doesn't put like some kind of a sign or tell you, like, hey, at your annual wellness visit, if you mention anything, we're going to charge you for 2 appointments and you'll have to pay for one of them. Or it's which is most of the case. I really don't think most of the time providers know it because we aren't necessarily getting like a kickback from charging you more, but some people do. Some people do. And healthcare is a business. And I hate that. And some people, it doesn't bother them as much. So they really do try to like rack up, bill it to the highest potential possible. To me, I feel that those people are evil. But that's just me placing my own feelings on it. They're not really evil. They're just trying to get paid for their job. Which they're more than welcome to do. They should get paid for their job. So let me take a quick break and see what we have to say in the comments. And then we'll watch this TikTok of this poor person who was figuring this out in real time. And let me know if you've ever experienced this and if you have any other tips and tricks for getting around it. But asking is honestly the best way, or just not bringing anything up and making it a whole separate appointment so that you understand like, oh, this is going to get charged as this. Lisa Ellis says, I don't charge them a extra for a couple of chronic issues. As far as I know, the coders do not add it on. And that's awesome. You kind of have to know the culture of your place. I apparently found out that the culture of my place was to be kind of greedy. I know some places will allow you, because basically what this comes down to is you are betting. The computer doesn't necessarily know. It gives you a warning. If you try to check out with the free code, the green cart, right? And it's like, hey, this is definitely a free visit. And it's like, hey, but you have things other than Z code diagnoses in here. And you can just hit that lovely override button and be like, it's fine. We're just going to pretend we don't see those. only process it as the free visit, you can do that. It is only in when if you have someone reviewing your chart, like an insurance company, and then they said, "Hey, this is fraud. Why are you doing these things and you're not billing for it appropriately?" And you can be like, "I'm going to burn this system down." And then they're like, "Well, you're going to jail or paying this fine." And then they scare you and you do it. But so there's that. Or so that's awesome that your office does that, because I feel like that's the humane way to do it. I expect you to, if you have a lot of things going on, I expect you to want to know about that. To want to discuss your other care. Most of my patients ended up just paying the additional amount because they're like, I'm not gonna like do this appointment and then come back in a week to go over my other stuff that I also wanted to talk about. And if we have time today, we didn't always. And sometimes I would just, you can kind of use that excuse of like, oh, we don't have time today. Let's bring you back. But a lot of people can't come back because they just can't take extra days off work. So they would just do both appointment at once, but it sucks. It sucks. And it's not fun. So yes, Michaela S. This is not something that was taught in school. This is not something that is highly publicized. Michaela S. says, I'm a nurse in primary care, and I didn't know until 6 months into my job that patients were charged if they talked about anything else besides the yearly visits and preventative care. Yeah. And like, again, it shocked me too when I found out. Trust me, I was a nurse practitioner when I found out, and it was horrible. J. Michael RN says you need to be careful because the codes are used in informatics to create scores for HEDIS and core measures. Yes. So that's how they kind of can like dig in and find. So like find what you're doing. And it does get complicated with like this. This is like a quality assurance type of thing where they can then look back and pull a bunch of data, and they basically yell at you and they say, why haven't you magically lowered your patient's blood sugar over these last 4 months? And you're like, well, because you don't provide me with any of the resources and you won't pay for the medicine that I said would actually be good. And you wanted them to fail the medicine won't work twice before you'll even start to try to consider it, if they will. Also, you don't cover anything until they're like $7,000 in the hole. That's probably why, but they're like, no, it's because you didn't document this properly. I'm like, well, aren't you a breath of fresh air? Hello, Sophia. And J. Michael and Sophia, thanks for being channel members. I appreciate you. Bell says, as someone with chronic illness, I haven't had a well visit in over 20 years, even though it's stable and well managed these days. I'm glad it's stable and well managed, but I hear you there, friend. OB Nurse Chelsea. Hello, friend. It's hard line to walk for sure. Sure, to make sure we get paid for our work and not feel like you're nickel and diming each patient. Yeah, it's a really miserable thing when you are in a profession to care for people and you care about people. And in order to make money, like the way you profit is by literally charging your patients money. That sucks. That's like morally dehumanizing, like morally disastrous, I might say. That's why I had to stop, because I was like, I can't, especially if you have incentive pay. So some places, I did not have this. I had just like, this is my salary. I don't get RVUs or something that's like most nurse practitioners, physicians, PAs, they'll have a thing where it's like, here's your salary, right? And then based on how productive you are, AKA how much money you bring into the practice, you can get money on top of this, okay? For how productive you are or how high you code things, right? And so there we run into, obviously, issues. Mr. Midwife, hello, Chad. But if it's brought up and I don't document it, then later in front of the man with the black robe with the little woman hammer, I'm screwed because I told Mr. Midwife I was having these issues. Exactly. And this is the other side of it, is if you don't document it and someone told you about it, then you are in trouble legally because they technically told you. So in order to, if you're a provider, in order to literally get around this, I would have people, if they were bringing other things up, I would just like stop them. I'm like, I'm like, before you say any more words, if you tell me anything more, I legally have to document it, because this is, like we're running this risk here. And so if you don't want to tell me, if you don't want to tell me and you want to tell me at a later time, or you're fine with talking about it today, I will probably have to charge you for a whole different appointment. And yeah, so I like to approach it from two ways. I like to just tell them right up front and then give them the chance and say, you can tell me. And if I think it's enough that we need to document it, I'm going to document it. But, proceed with caution going forward. And if I think we don't need to worry about it, then, I'm happy to, tell you what brand of Band-Aids that I think you should buy, or eye drops. But other than that, we're going to have to try to wiggle around here. And yes, so that is that. Try to warn people. Um, Mr. Midwife does not get incentive pay. I did not either. Um, and Michaela says, yet when you have a patient who has diabetes, their insurance company expects the patient to come in every 3, 6, 12 months based on their A1C. And if the provider doesn't make this happen, they're considered incompetent. Yes. So in case you didn't know, also, if you don't meet the metrics the insurance company would like, so say you have a patient whose blood sugar is a little bit high, and you don't get their blood sugar down, because it doesn't matter why. It doesn't matter if it's because they can't afford the medicine, because they literally can't afford the visits to come to you, because like, even though they have insurance, they have a $7,000 deductible. So they have to meet that first before the insurance will pay. So they can't come to your office because they don't have the money for the visit since it's not covered yet. And they can't pay for, their working crazy long hours, then they don't have the resources in their area or the time to worry about like cooking healthy meals and exercising. So you know, their blood sugar is not going down. Yeah, you get dinged hugely by insurance, who then writes all sorts of nasty things about you and then threatens to not pay your office whatsoever. And yay. So that's what that is. Modifier 25. Scott, I do not remember. In codes, you can modify things. I do not remember. I barely got the codes down, Scott. I wasn't modifying things. We barely got that. So that is the very sorry situation. Looking for Scott. Scott, did someone say Scott? Punishment for Scott. Scott sent us, I'm so excited. We'll watch it on Friday when we do our live as a panel. Do we remember Air France? But did you die? Because he's excused from this mentally for me, because he made a phenomenal a wonderful ad, a fake ad for Air France. So in my mind, he can do no wrong today, because I nearly peed myself laughing. So we have that. Enid Pena said, my provider told me we can make a separate appointment for my concerns, so I wasn't billed more. This is good. But what if you can't come back? Then that's a problem, because you still can't talk about any of the stuff. You know what I mean? You can have the same build on the same day, but it's just difficult. This person, Lottie, they had a doctor automatically come out when I got my flu shot at their clinic because I hadn't seen one in too long. And then they charged me $65. That's really crappy. So what a lot of people will do is they will, you need to be seen per your insurance again, once a year for them to stay happy with you. If you aren't seen in 2 years, then you're no longer considered a patient technically at a lot of practices. So when you come in for something little like that, they will want to charge it in a way, because a vaccine visit alone is a nurse visit. It's not a real visit. They would want to do that to try to capture it so that they could tell your insurance, yes, you're still an active patient, and the insurance stops bothering them saying like, hey, this patient hasn't come in. Why? And they don't get dinged and like held against them. And then their score doesn't go down, because like we had said, like your HEDIS score and all of that stuff, that reflects on how you are as a provider, and they can like look up those scores, and that's how they can like recommend practices as well. So if you don't score well on the insurance company exams that you literally have no control over, because like I wish I could, but I can't make it so that you can afford to come to your appointment and do all the things to live your best life. Then they like it really dings you. So this is totally garbage, Lottie. I'm really sorry that happened to you. That's probably why they did it, which does not make it ethical. I would never do that. If someone came in and they had that for me, I'd be like, hey, just so you know, like we haven't seen you in over a year. We just like to see you every year and check in. Which then, can you see how this is hypocritical? Because I'm like, hey, we just want to make sure you're fine. Come in and check in. You need to have your we'll do your preventative exam. And then they come in and they say something that like isn't perfect. So then we have to charge them. Which it blows my mind. I'm like, we don't really want people to be healthy, do we? Like, we really don't want that. Church of POS says that depends on the insurance company. I worked for several insurance companies. None of them had that requirement. We all had all kinds of free programs to work with patients. Well, I want to know what insurance company that was, because all of mine have had that requirement. So that you had to do that. So I want to know what that is, because Aetna, Cigna, Blue Cross, what's the Capital something, all the big ones have always, 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 always required all of those things, and it is mind-boggling. Jason Stewart says, it also makes the provider look greedy when they're just doing their job, and it isn't necessarily the case. Exactly. It's not greedy to be asked to be paid for the things you're doing, but inherently when you ask to be paid, they're taking it from the patient because we work in a for-profit healthcare system where you have to pay for that. Thank God that hasn't been the case in my practice. I'm glad. And I love little practices sometimes because you can get away with things and you can be scrappy. And yay. Yes, it's a mess. Insurance did forgive the charge after I called, but I was confused because I emailed my doctor to order blood work. Yeah. So good, Lottie. I'm glad they took it back because they wouldn't have, the ability, you wouldn't be able to chart anything for that visit, right? Because then anything you said, you'd be like, well, you didn't really do anything here. You know what I mean? I have battled this. Getting upcharged is a whole different topic of, it's difficult when you know the healthcare system and then you start seeing bills come in. Like, I know how to bill in primary care. And I would have a lot of instances where my children would be seen for a little visit. Like if the girls had an ear infection or something when they were younger, and they would bill it as like the bigger shopping cart, a 99214, when it was really like a very cut and dry. You came in, you looked in their ears. We gave them the antibiotic. It was in both ears. Here we go. And that is billed as a 99213. And they would build it as like a 99214 or even like a 5. And that is just scammy offices who are being pushed not by their providers, usually, sometimes by their providers, but by the office who's coding it. And they're trying to like get, there's people who are trying to push as much as possible, hoping insurance companies don't look into it to say like, hey, there's not enough documentation here to support the giant shopping cart you just ran through and charged this patient. And that's a whole different thing. That is a whole different beast. Because then you're calling and you're like arguing with them. You're like, no, I know what a 99213 is, and you should not be charging me this, which you care about if you have a high deductible plan. And the difference is, $125 versus $200, which is a lot. Michaela S. Also, did you know appointments cost different things in different states? Fun fact. Also depends on your insurance, but mostly it depends on your state. So like in Michigan, you could have a small shopping cart appointment for $88, but in North Carolina, it was $122. And that's just based on Medicare reimbursements in the state, or Medicaid reimbursements, even if you don't have Medicaid, they decide it. So it costs different based on where you live. So always check what the states next to you, how much theirs is worth, because I had a lot of people, I've heard of a lot of people, like Pennsylvania's base shopping cart rate for a visit. So the smallest one is almost double, I think, what it is in Delaware. And Delaware is very close to Pennsylvania. So a lot of people go down into Pennsylvania to get their health care and they'll pay out of pocket because it's so much cheaper than trying to meet their deductible here. It is a hot mess. Agreed. Noralia. This is why healthcare is so broken. Yes. Yes. Another, J. Michael says, another cost is you can't do labs and office visits on the same day in Medicare. Medicare has a ton. Yes. Medicare has a ton of hoops to jump through. Another thing that I don't know if they've resolved, but in my practice in North Carolina, we couldn't do a physical exam, like a regular your checkup and a pap smear on the same day. They had to be 2 separate days. I was like, why? Because technically they're billed as different Z codes. So they both go in the green shopping cart, but the green shopping cart is very small. It only fits 1 appointment a day. So you couldn't put both of them in, versus when I was training in Michigan, you could do both in one day. So you could get a patient in, talk to them about everything. We could talk about all the different systems, get their pap smear, and get them good to go out the door, because for a lot of people, getting to healthcare offices is very difficult. It requires time off of work. It requires transportation that they might not have. But the health insurance companies were like, no, you can't do that on the same day. So let me know in your state if that's a thing, because it's not in all states. But it's ridiculous. It is ridiculous. And Susan says, I have Medicare. My doctor's office has a lab that I do both same day in Florida. And this is again, Medicare and Medicaid are state run, right? So they are each dictated by their state, and their state gets to decide how they get to decide how they want to dictate all of that. So yay! Carly Rousseau says, I work in a mental health clinic as a nurse, and double billing issues are horrific. Yes, they really, really are. I literally had absolutely no idea. Absolutely no idea that this was a thing. Elle's mom says it's a thing in both Maryland and PA, not a thing in Massachusetts. Why? Why? Blue Bubble Gum says, do nurses in the US learn billing in school? No. Do nurse practitioners, PAs, and physicians? No. You're supposed to figure it out on the job or hope you get a job where someone else does the billing for you. But really, we had like maybe one lunch and learn in NP school, at least at my school. And I think it was because the teachers didn't have to do it because they all worked at the school's clinic, which billed it for them. And billing is evil. Absolutely evil. If you do want to know more about billing, I did take a course. I used to have a discount code for them. I bothered the owner. And I bought one. It's called like billing and coding. I will link it down below if I remember. Rachel, remind me. And I think I have a code that can get you like maybe 20% off, but wait until Black Friday this year, because that's when I always buy my CEOs from this company. And I'll leave a link down below. And if you need billing and coding helped, that's literally, I bought it, this same program that I'll recommend to you. I bought it when I realized I don't know what I'm doing. And it's pretty great. Since they don't really teach you, and then my poor biller, she would just call and yell at us in a very kind way. She was frustrated that I had never learned, and I felt bad and I was sad. Church of POS said, I will let you in on a secret. Most of the insurance companies have auto approve for low cost service. No one reviews them. The higher cost services are the ones that may get reviewed. So this is a good point too, that if you're billing in the lower shopping cart tier, it's going to get reviewed less, but a lot of people can't even afford the lower shopping cart tier, but that's an excellent piece of advice. And thank you. So I appreciate that. They do tend to review if you're trying to push the giant shopping cart through of like, we have all these diagnoses and we're going to get paid a ton. They usually like to look at that because they're like, wow, that's like a 2-hour appointment with like a procedure, and you sent the patient to the ER and you did 40 of those a day. That seems impossible. That's when they start to look at it. Jason Stewart said that's how it is in Virginia, and the patients get rightly upset about it and tend to take it out on the provider. Yes, that is how I learned about this. I was screamed at by some very angry patients who were like, why did I get this bill? I'm like, I don't know, you shouldn't have. And then the biller was like, yeah, you should have. And I was like, I hate this. Why did I think this was going to be a good time? Okay. Why did I think this was going to be a good time? Mr. Midwife, Chad says, bill it as a Z01.419, a well woman exam, which includes a pap smear. Yes, but then you get dinged if you don't also bill as so in primary care, we have to prove that they have done a well gynecologic exam, like a well check for the reproductive system, including a pap smear, or that they're up to date with it. And we have to show that we've done a regular other medical wellness check. So we have to do both. And therefore, it's evil. Otherwise, they yell at us and they say, well, you aren't checking out this person's cervix. Why not? Have you talked about breast exams? And you're like, I hate it. I hate it. So let's take a look really quick. Let us take a look at this TikTok and see if it reminds me of anything else that we have not felt inside internal rage about this. But yeah, that's the basic rundown, friends. Ask if it's your wellness visit. Am I going to get charged for saying this to you? If you would rather go back on a different day, great. If not, know that you're probably going to get charged for it, which is evil and awful and it sucks. And if you're a provider, maybe just warn your patients. Be like, hey, if you do bring this up, if we proceed, I'm going to have to charge you. I know, I hate it too. I hate it as well. And one day we will change it and we will rule the world. All right. Let's see if I can get this to have sound. Someone let me know if you hear it.
I'm so pissed at my pediatrician's office. to the point that I'm just literally changing pediatricians. I'm so mad. So, oh, well, baby, like child checkups are covered by insurance because they're like a healthy kid checkup. You're just making sure that, growing right. So, this little dude's 2-week visit, I got a bill for like as if it was a sick child visit. I was billed for a well baby visit and an office visit. So I called and I'm like, why is this? This was just a normal well baby visit, just 2-week checkup. So the doctor wrote in her note, mother concerned with overactive letdown and oversupply of breast milk, baby fussy after feedings. Because she wrote that in her note, apparently he's diagnosed as a fussy baby, and that's a diagnostic billing code. And so
this person had to write a diagnostic billing code because they couldn't just write in it that they like that the baby was having these issues without making it sound like a problem, because then they couldn't address the problem. And if they just wrote that down without like saying, and here's what I told them, because then they can get sued, right? So if mom said, I'm having an overactive letdown, baby's really fussy, I think we're having this, and they just documented that in the upper HPI portion where you're writing your notes, and they can't go down and insurance companies can see, oh, and here's where they addressed it, because everything you write about up in the top of your note, which is where what the patient is saying to you, right? When you're saying something to the provider, they should be writing it down at the top. We call it the HPI, the history of presenting illness. We have to have, if you mention it up here, it has to be in the diagnosis part. Okay. If it's up here, it has to be down in the diagnosis and treatment part. Otherwise, they're like, hey, friend, why didn't you do anything about this? And in order to put it down here, remember, we have to boop, scan it, give it a number, and put it into a shopping cart. And if it has any number other than everything is perfectly fine, which goes in the nice boop green cart, you're going to get a bill for it because it's evil. Evil. Oh, why are we on the wrong TikTok? Oh, we found it.
Office. To Hopefully the point that I'm just literally changing pediatricians.
I'm she's starting again.
So, oh, well, let's baby, like child well baby visit, just 2-week checkup. So the doctor wrote in her note, mother concerned, and that's a diagnostic billing code. And so I challenged it, and I was like, no. She asked me how he's feeding, and I told her how my baby's feeding at the 2-week wellness checkup. But then they told me anytime you bring up a concern to the doctor, you have the chance of getting it charged. What? She asked me how my baby was eating, and I told her how my 2-week-old baby was eating. Then I challenged it, and they went through like the review billing process or whatever, and it stands. I still have to pay as if as if it was a sick visit. I'm literally, I don't have words. They said, sorry, fussy baby is a diagnosis. No, fussy baby is not a medical diagnosis. There was no tests run, no labs done, no medications given, no diagnosis. That's all I said. And what my pediatrician said is, oh, babies get fussy after feedings. It'll just get worse before it gets better. So that pissed me off.
So what probably happened here was her pediatrician almost positively did not aim to bill her at a higher level. In order to address the situation and remember it for later, they probably just wrote down below, like, oh, there is a diagnosis for fussy baby. So like, let's just put that. And then you can document your education. That way, in the event that someone comes back later and says, well, this parent brought this up to you, why didn't you do anything? You can be like, hey, I did. I said that, hey, reassurance was given. That's what I would write in my treatment plan, would be like, hey, reassurance given. This is totally normal. If it's not, here's what we're going to do. And if this continues, I always like to give a contingency plan. Like, and if this keeps going, maybe we'll look into X, Y, or Z. You do not have to have a medication given, a lab ordered, a actual anything occurring other than like verbal validation as a treatment plan in order for it to be billed as a diagnosis. So I bet that pediatrician probably just in some bigger offices, you can just keep your Z codes and someone else actually goes through your whole document and decides which shopping cart they're going to push it through in. In smaller offices, I got to decide which shopping cart I wanted to use. Do I want to use the tiny green one that is free? Do I want to use the small one and push it through that way? Or do I want to use one of these bigger ones? If you are not the one pushing the shopping cart through and picking the shopping cart, which probably happened in this case, pediatrician probably didn't even think twice of it and pushed it on through. Maybe the pediatrician was like me and they were like, oh, I'm going to write this down so I remember later. I have to give it a diagnosis if I want to chart about it, because the computer literally will not let me chart about it unless I give it a diagnosis. And wham, bam, thank you, ma'am. had no idea. Might not have had any idea that this was going to be charged. And I cannot fathom trying to do this in pediatrics. Okay. I hated, like, I loved seeing kids in my practice. So as an FNP, I could see children as well, like womb to tomb. And I loved kids' well visits. I loved seeing those. But I will tell you, almost every single one of them, we had to charge as a actual visit along with their wellness visit because there was something that the parent brought up that we had to document. And it was awful. Like, because I was like, okay, well, you want to talk to me about how your child's about their eating. And, it was maybe going to involve, like, I need to cover my booty. So I'm going to write about it, especially because it's a kid, right? And I really, 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 sometimes I'll fudge it. Like sometimes, like I already said, I would fudge it for an adult. I'm like, why don't you tell me and then we'll figure it out? But for a child, you really wanted to write everything down because it can change so much because they're not making the choice to not have it recorded, right? They can't give consent to that. And it just seemed a little bit more litigious in the child department. So you'd have to write that down. Hey, you're probably going to want to give your kids allergy medicine. We just went to the doctor for my child's, their annual wellness thing. Got a bill for Piper because who was 3 because she asked she could see that she had a runny nose and she was coughing and I didn't even say anything. I was literally she's like, "Oh, like are you worried about this?" I was like, "Nope, I'm pretty sure it's just allergies." Wasn't even thinking about it. I was just like, "Oh, I'm pretty sure it's just allergies." We're giving her Claritin. Like she was like, "Oh, are you giving her anything?" I was like, "Oh, Claritin." Literally, that was the only conversation we had. She's like, "Are you worried about it?" I was like, "No, it's usually well controlled when I remember to give her Claritin, but her mom kind of sucks sometimes, and sometimes I don't remember." So we're here. Yeah, got a message this morning in my patient portal. Hi, you owe all of this money for this appointment you had at your physical because you mentioned, you bet it, you mentioned that she has allergies, and now you must pay $125 for the privilege of being able to go and buy your child overpriced medicine over the counter. So that's that. If anyone else has anything to add, that's my end of my rant on that. I feel really sorry for that human. People in the comments were saying like, "Oh, this is fraudulent." That insurance, that's called insurance fraud. Call your insurance company and inform them. It's not insurance fraud. That's how crappy our healthcare system. Every symptom has a billing code attached to it, thanks to insurance. Yep. Alice Lee on here said this also applies to your wellness visits as adults and Medicare patients when they go to their annual wellness visits. I'm sorry this happened. And yeah, so that is where we are. In case you want to avoid it, just make sure to really clearly communicate what will this be charged at. And yeah, this is a huge reason why it's sometimes cheaper if you have a high deductible plan to go in and go to your healthcare, your primary care instead of urgent care. Primary care is always cheaper than urgent care. If you have a copay, it doesn't really matter quite as much, but things like that. But just always communicate, ask what it's going to be charged. And if they don't know, have them go and ask. I don't know is never a decent answer. They should be able to give you a ballpark of how much that appointment is going to cost. And usually they can go in and look at kind of, it's like your biller should be able to know that. Your office manager should be able to know that. And generally, if you want to really know, go to the cash price and then add like 20 or 30 bucks. And that is usually what it is because cash prices are often the littlest. Mary Kay Candell said at yours practice owners, if you don't up bill, you will go bankrupt, which is horrific. That is stupid that is how that works. This is a huge issue in primary care. And upbilling, in case you're curious, is upbilling is what we kind of said, where you come in for a cold and I tell you, hey, I can't give you any antibiotics for that. Or in the case of my daughter, like, hey, here's your, they have a double ear infection. Let's give you some antibiotics. And I'm going to bill, this should have been a small shopping cart and they skipped the middle and they went with the large. They were like, hey, we're going to push this all the way a large shopping cart and cross our fingers that no one digs into it and looks, because we don't have, in order to get to this big shopping cart, remember, we have to have at least like 5 diagnoses. You have to spend a certain amount of time with the patient that you have to document. Hey, I spent this long with them. Hey, I did this procedure. I examined every single body system. I have this somewhat complex treatment plan. Like, you have to justify why you're charging that much. And they're really just hoping most of the time, I'm going to charge this higher bill. I'm going to hope that no one looks into it, because our like our office is sinking. So we're going to up bill, is what they'll call it, and they'll sometimes tell you, "Hey, make sure that you are kind of filling out your appointments to up bill as much as possible." And that is when all of a sudden they will start doing way more comprehensive assessments than they need to be doing, and they're like asking you all these other questions. It just gets into a whole mess of, all of a sudden, you're documenting, they're wanting you to document a bunch more that's like not really necessary, because it's kind of the honor system of like, when you go to the provider and you have a cold, they don't need to do everything. They shouldn't be checking your reflexes. But all of a sudden they're like documenting your reflexes, and it's because they're trying to bill at a higher level, and it's a mess. An absolute mess. Second opinion, don't forget to like the button, give it an odd number of chest compressions so we can share and spread this information. Yes, please. Thank you. Save the life of this video by liking it. Mr. Midwife said, the healthcare is a business. They're there to make money. I have a family to feed too. It's terrible, but that's the way it is. And that's kind of the double-edged sword of it, is you have to bill people to make money, because it is a job. Like, it is our job to go up and show up, and healthcare providers like need to get paid. And it sucks that it puts people in this moral like dilemma, of people who, like me, are feeling like they're losing their soul charging people. But at the end of the day, in our country, healthcare is a business, and yikes. And I hate that. And certain people feel worse about it than other people. I really have a hard time with it, mostly because I see so many people that can't access care because of it. Walmart doesn't feel bad about charging money for their groceries. No, but I probably would if I worked there, and I would if I worked there and I saw that people couldn't afford their groceries. I would feel really bad about it. Walmart doesn't care as a whole, because they're a giant company, and that's the way healthcare is, and it sucks. Michaela S says, I understand visits are cheaper in primary care, but when you have patients that come in with acute concerns like a possible heart attack, it really makes me think about our insurance companies. Yeah. And this brings up a whole different topic of insurance companies and healthcare in general reimburses primary care the least of like anybody, as well as pediatrics. So in our healthcare system, so like, how I was saying, for a small shopping cart, it's $125. That changes. That small shopping cart changes based on what setting you are in. So in a hospital, they're going to get paid a lot of money for a small shopping cart because you're in a hospital. If you are at a orthopedic surgeon's office, that small shopping cart is going to be like $300 starting. So at least double. And your appointment times are going to be way shorter, so you can cram way more of them into an hour. Same thing with dermatology, where your small shopping carts of diagnoses are billed at crazy higher levels when you go to check out, and their appointment times are usually very, very short because they're only focusing on that one thing. So we have a situation where primary care is getting paid the absolute least, but we handle the most, and our appointments tend to go the longest, in general, like I'm sure people have longer appointments, but because you're trying to cover literally everything and being like, hey, I have this toenail infection. I'm getting a divorce. So my mental health is in the toilet. I am, I have this cough that won't go away. Oh yeah, my blood sugar is totally not controlled. This medicine is giving me this side effect. I also haven't pooped in like 3 weeks. And I I got bit by my dog, and it's like oozing pus, like all in one visit. And they're like, is that fine? And you're like, well, we have 15 minutes and I'm going to get paid like nothing for this. And that, my friends, is why our system is flipped the wrong way, in my opinion, because it burns primary care out because you're working so hard and you're getting paid like nothing for all of this. And you're working way over your normal hours, because then You don't have time to chart. You don't have time to do any of this. And it is just a absolute hot mess. So absolute hot mess. M says in urgent care, they wanted nurses to start ordering tests before the patients were even seen. The nurses pushed back, and every provider works differently. Some orders more tests than others. Yes. Again, a lot of providers, first of all, ordering tests before patients were even seen is yikes. When they order those things, they're getting money, right? Especially in urgent care, they want to run some more tests. They also have to keep it in balance of, can we justify this? Because your insurance company might come back at you and be like, why did you run a strep culture for a UTI? That makes no sense. But they have to walk that line. But when you add more things, like I worked with a lot of healthcare providers that would do the most, even if the most was not needed, so that they could bill at a higher level. Yeah. Uh, Chelsea's telling a story. Let's go find the beginning. So, my doctor friend got pushed out of our healthcare system because he refused to run unnecessary tests and stuff for insurance purposes. The hospital system fired him and he had to go into private practice because he wouldn't run every single diagnostic. He would skip steps based on the clinical expertise. And they didn't like it because he was not bringing in as much money. Yes. Yes. Yeah. That is basically how it happens. I have been in my friends have literally been in offices where their jobs told them, hey, we're going to upbill. We're going to, anytime someone comes in with this presentation, you are going to run X, Y, and Z. And they were like, we don't need to run X, Y, and Z every time. Like every time someone comes in with chest pain, let's say chest pain they would say you have to run an EKG. A lot of the times it became pretty clear pretty early on that like this is probably anxiety, or it's like, oh, I'm having panic attacks, very classic panic attacks. We know I have panic attacks. I'm coming to you because we need to manage these better. And they would be like, oh, you need to run an EKG. They were like, don't need to run an EKG. Everything seems fine there. And they were like, no, you have to. If you are documenting this, you have to do this to make more money. J. Michael, thanks for being here. We'll see you maybe Friday. I hope your appointment goes well. But thanks for being here and hanging out. Angela Lang says, this makes me scared to even finish psych school. Sorry. I wish I could help you there. I don't know how it works in psych. I don't know how their billing works. They make a lot of money though. I do know that their reimbursement is a lot better than primary care. They're one of the ones that do make a good amount of money. And psych is kind of, not all psych does this, but a lot of psych people, it's kind of like in and out the door. Here's your medicine, ready, set, go. But you can be the change in that. Go be the change in that, Angela. Michaela S says, I'm really lucky that provider orders the least amount of tests and treatments as possible to help keep costs down. It's a reason our patients appreciate them so much. I love that. I wish everyone was like that. Ugh says, I hated running EKGs for costochondritis if you palpate and cause pain. And this was another huge one, was costochondritis is like when you have pain on your bone right here, like, or on the ribs as it connects to your breastbone here. And it literally, if you push on it and it hurts, that doesn't happen with a heart attack. Like, oh, you probably overexerted something here and it's making this hurt. And then they're like, well, you have to run an EKG. And it's like, no, I don't. This is stupid. We didn't exactly get along, Hanks. Yeah. The hospital, Weird Science Guy says the hospital I worked at purposely started making people who were getting elective surgeries have their surgery at the hospital OR instead of the ambulatory surgery center so they could charge them more money. That's shisty, and I don't like that. I hate that. You get a lot more money for having a surgery in a hospital than at a surgery center. So they can make those choices. And I have big feelings, in case you can't tell. In case you can't tell. So yeah, this is a thing. Please Please try not to overbill your patients, but also you do need to get paid for your time. So just bill appropriately. And then we can advocate for change on a different level in try to fix the system, not by price gouging our patients who I feel bad for. Mostly because I've been that person. I've seen countless of those people who cannot pay for their health care. That's why I left primary care because it broke my soul. And also, I've experienced that as someone who also has a high deductible plan and cannot afford healthcare. Oh, yay, yay, yay. So that's that. How else are we doing in life, my friends? We can chat and just chill for like 15 minutes and just hang out and hopefully talk about something more pleasant. I went out into the woods today. This is a very very sharp right turn. We're going from a very serious topic to like, oh, hey, let's talk about the woods. We have in a lot of woods like on our property, and my children, now that a little bit of like the leaves are starting to fall off, are able to like get into the woods now, and they've also like gained a little bit more confidence. We've lived here for a while. And they are venturing into what they call their magic forest, which I love. I'm like, I love the idea that you get to go and experience this in your backyard. But there's lots of prickle thorns, bushies. Like the woods are overtaken with this super invasive species of vine. And they have horrible prickers on them. And it's just like everywhere. So I went out and I spent like the whole afternoon. It's one of those things where I went out, I'm like, this is going to take me like so not long at all. I'm just going to go out here and just cut a few plants down, and then my children can play happily in the woods, happily ever after. Yeah, that's not how that worked. I was out there for like 4 hours. I'm very sore now, and my fingers are filled with little prickers, and I feel like I pull one out and then I don't know about the other ones because like this other one hurt so bad. So I'm just sitting here like looking at my hands that are filled with tiny little thorns. And I need to go have Joe pretend he's a surgeon and get them out. I have a scalpel that I think we're going to go perform some home surgery on and just like nick it open and yank some stuff out. It's going to not feel good. Maybe I'll have a beer first. Michaela says, please don't tell me you got poison ivy again, Liz. You worry me sometimes. I worry me. I now go out. I have a really fun. So if you don't know, I got systemic poison ivy everywhere that then went like into my body, and I broke out in a horrible rash all over my body, and it looked like I pretty much had second degree burns everywhere, and then all my skin sloughed off. That was from poison ivy, which apparently I'm very allergic to. So now I go out in like a sweatshirt like this. I do this, and I tie it under my chin. I'm working on getting a beekeeper's hat. Okay. I've ordered one on Amazon. It is coming to go over my head so the oils don't get in. And then I put on gloves that go up to my elbow, but apparently they don't keep out prickers from my fingers. They, because they got through, some of them did. And then I put on leggings, and then pants, because I'm paranoid. And I wear long sleeves tucked into my gloves. And then I take tube socks and I pull them up as high as they will go on both of my feet outside of my pants. And then I wear my rainbow Crocs and my sun hat and my apron, my garden apron. So, I'm a sight to behold. And then I go and wave at people frantically, all of my neighbors, some of whom don't know me yet because they're just moving into the neighborhood. And so I go running through my yard and I'm like, hello, hi. Like, cause I've been there. I was the second person to move into my neighborhood. So I feel like it's my job to like greet all the new people. So they'll be like out on an unsuspecting walk with their child or their dog. And I will like come barreling out of the woods at them, like waving my arms, being like, hi, do you have a second to stop and chat? And they're probably like, hi, no. Like, please no. And I just start chatting with them. And then I kind of remember what I look like. And I'm like, oh, like, well, I'm in the yard getting thorns out. And they're like, I see that. But like anytime your little one wants to play with mine, we're just out here hanging out. No one seems to take me up on these offers. And oh, I have a picture. I will try to find a picture. No one takes me up on these offers. So unsure why. Clearly it's a great look. Um, but yeah, one day. One day. I have my core groups of friends I have like three people in my neighborhood who we all hang out all the time and no one else wants to be my friend. And I cannot imagine. Whatever you do, don't stop. Drive faster. Don't look her in the eye. These people are on foot, Chad. They're on foot. They are on foot. And yes, so hypothetically, could you get poison ivy in your eyes? Yes. Yes. You could get it on the inside of your eyelids. Is there some reason you're not wearing PPE in the woods? I literally, I'm like, can I get a pepper? Put it on. And we'll do that there. Now you have a cautionary tale to tell everyone about poison ivy. Yes, exactly. Stop scaring your neighbors. I figure so they're still selling lots down the street from us and then directly across from us. So I figure that this is a really good test. You know what I mean? For like, if you want to come look at the property, because I have waved like a mad woman at the people looking at the property across the street. And I just come out and I'm like, hi, I'm Liz. If you have any questions about living here, let me know. And I do in those moments, I will admit, try to be as weird and loud as possible so that they're kind of like, huh. And then I also have my like witch trellis that my neighbors all think is like a witch, something for like a ritual, where I basically went out to the woods and I got a bunch of really thick, like they're like this thick, like vines, and I tied them all together with twine and I made a lattice that my blackberries grow up. But it looks a little bit ritualistic. It's a little bit homemade, but it kind of goes with like the forest vibe. Um, and so we will, we're going with that. You know what I mean? We are going with that. And it's, it's how we are. Honestly, I'd stop and talk. I love being friends with the quirky neighbor. That is my goal in life. Joe and I have said many times that we are never leaving our house. And so my goal is essentially to just be that weird lady on the mountain who, because we live on like a mountain, like crochets and just has a million weird ADHD hobbies that are like overflowing from her house. They'll be like, oh yeah, that's Liz. We just let Liz kind of be over there. Don't go over there. Don't go over there. Just let her be. She has chickens, illegal chickens in the woods, and an alpaca. I'm trying to build up, like, I spent the other part of my day today also. We have this little patch of clearing where like our septic field is. And I want to plant, it has to stay clear, right? Because it's our septic field. I want to plant trees, big tall trees. That's what that was in front of it. And then hide chickens in there because we're not allowed to have chickens. And then some alpacas. Okay. It's a good sized area. Okay. And I really would just like to hide them back there. Who's going to know? It'll be like my little mysterious little secret. They'll be like, I thought I heard chickens, and be like, no. And then I'll just run streaking by in my full on regalia bee suit of wonder. I'll be like, no, it was just me. I was just running around. They'll be like, Liz is just crazy. Don't even go over there. So no one will ever know that I'm running an actual homestead. So the septic field is like supposedly a modern septic field, and it goes through like 3 filters before it goes up, and then it waters this area with filtered stuff. But yeah, it's technically not. We don't think about it too much, Scott or Chad. Just to be totally honest, we just don't really think about it. We just go. But our septic system, it's like one part of it is down the hill, and then it filters it like through all these weird filters and pumps, and then it pumps the water that comes out of it up the hill and onto this like thing. And they had to like test it to make sure, it got all of the stuff out of the septic system, that wasn't up there, and that it's okay to be up there. And apparently it is. They said technically you could grow food on it. I was like, I'm not taking that risk. I'm just not doing that. It's Halloween year round at Liz's house. So true. Very haunted. Cats. This seems like a cat's house. Dogs. Downhill. Sorry, neighbor. Exactly. Oh, we have never had a septic system before, and it is enlightening. I it terrifies me. Septic field. It terrifies me. I didn't know, in case you have one and you don't know, you can't put like bleach in it. You should not buy toilet bowl cleaner that has like bleach in it. You shouldn't buy hand soap that has a whole bunch of antiseptic in it because you want all the good bacteria. Um, I, being the, interesting individual I am, I asked, so the septic person, when he installed our septic, he was talking about like, he's like, oh, you want the good bacteria to grow and you don't want to put all these things into it. And I was like, got it, got it. I was like, so I make sourdough bread. And I was like, so I could just put my sourdough starter. Like, what if I fed the septic tank? Like, could I flush some of my leftover sourdough starter? Because with sourdough bread, you have to discard a lot of it. And I was like, so can I just like flush that down the toilet? And will that feed my septic tank? And I'll have the best bacteria, like good bacterial biome in my septic tank. And I also like sauerkraut and yogurt and all this other stuff. I was like, should I just put that in the septic tank? And this man looked at me like I was insane. He was like, please don't put food in your septic tank, ma'am. I'm like, no, I'll put it like down the drain or down the toilet and it'll like flush down there. He was not matching my enthusiasm. And I had a lot of enthusiasm. I was like, my new random life goal is to create the best microbiome ever that a septic tank has seen. No, apparently. Apparently not. I would be careful planting trees in the septic field because you don't have roots to grow in the system and cause trouble. I'm planting it in front of it. Thank you for your concern. I wouldn't plant them in the septic field. There's like a septic field that kind of looks like a soccer field. It's not as big as a soccer field. And I want to plant it like a good, 20 yards in front of the septic field. So it just hides it. Just like it used to be hidden. And then they came in through and they tore all the trees out so that they could get the septic system in. I'm giving you like, you're probably like, what are you talking about? And so I just want to re-hide it and kind of like close in the little magical forest. Septic field sounds like a Halloween costume. Yes. Which time? Haven't you had to have them install it twice? So they've only had to install the top part, which is the drip system, which basically it sounds kind of cool actually. Basically the system at the bottom, the one at the bottom of the hill, which has the huge tanks, that's what has got a crack. Like the seal broke and it filled up with rainwater and then it threatened to overflow. And every time you went to go like flush a toilet, you were like, am I going to flood my whole house right now? That has been resolved. They've replaced that. It pumps it up, it filters it, and then it pumps it up and it has a computer. And to get rid of the water, it has, I don't even know what they said, like 500 yards or something of tubing under the ground, like pretty shallow. And then it has like a bunch of holes in it, and a computer tells the water, like closes and opens the holes. So it spreads the water out like over this whole septic field area. So it doesn't all like flood, which I actually thought was interesting that it did that. I was like, that sounds fancy. Also sounds expensive when it breaks. Oh, the joys of living rural. Exactly, Hunter. I didn't know any of these things until this year. But that's what we have. Yeah. Mom, why do these apples taste like poop? For real. And yes, septic systems sound like somewhere I don't want to get floated when the census is low. Exactly. Wait, what's a septic system? So a septic system is when you live in the country, there's no communal sewer. So normally, when you use water or your toilets or anything like that, and you flush or you shower or use water, it goes into your drain and it goes into the communal sewer. But if you live far out in the middle of nowhere like I do, and there's no communal sewer because houses are like too far, there's no way to there's just no sewer because they've never come through and connected one because we're in the middle of nowhere. So you have to like basically get a giant hole in the ground, like a huge, container, vat in the ground that everything goes into. And then there's many different types of septic systems that then deal with all of that and distribute it. So yes. Yes. If you go back in time and watch some of my, when I used to do like vlogs and stuff, you'll get a preview of what my yard kind of looks like. Yes. And I show my yard on Instagram a lot too. So if you follow me on Instagram, it's at I'm.nurse.liz. You can see my adventures with the prickle thorns today. And my wow, I'm learning so much. Yeah, I this is something I did not know a lot about. And when they told me we were going to have a septic system here, I did falter. I was like, excuse me, what? Excuse me, what? Uh, but it's so far it's been fine. So far it's been okay. It's been okay. We really panicked when they said we couldn't have a garbage disposal, but then we found a company that would do it. They like told us 8 million times not to do it, but I talked to a lot of people that had a garbage disposal with a septic, and it was fine. But that did cause a lot of panic because I do need this garbage disposal. I'm very weirded out by soggy foods. That's like one of my things. So we've solved that problem. Yeah, Scott, it is absolutely the opposite of a sterile field. Did you get a new picture? It looks really nice. I like that picture of you, Scott. Yeah. So, things that you'll learn on things that you will learn on these live streams. So anyway, that was my day. I don't remember how that started, but yes, we have my children can now play in the prickle-thorn forest. I have planted one oak tree, the solitary oak tree, and I'm telling you, this sucker must live. Let me see if I can find a picture of it for us real quick. I went out and spent an absurd amount of time getting this tree. Let's pull this down here. And then where's a picture of my children being generally? I took a picture of them by the tree so that one day when this tree hopefully grows up and is like beautiful and tall and majestic, we can be like, oh, hey, look, do you remember when we planted this tree that I found in the forest? It took me a very long time to find an oak tree. I watched some YouTube videos that said oak trees were like the best type of tree to plant or whatnot because they support the most natural wildlife like caterpillars, and they feed a lot of birds. And it simultaneously made me terrified that our world is going to stop working, and that I could save it by obviously planting my one oak tree. So here is the oak tree. That's kind of like a sideways part of my yard. That pit right here, that space right above the oak tree, that is the devil ground that gave me all of the poison ivy that destroyed my life. But I scoured for a very long time, friends, a very long time in order to find this little tiny oak sapling, like the internet told me to. It said this was the best way to find it. Get the whole tap root, which I did, which is that root going down. And we planted, in case you can't tell, like Sophia said, we took a sharp right turn after the frustrating healthcare system. Yes. Yes, this is how I maintain my mental health is gardening. And then here's my children by it. And it's right, the very tiny tree. And hopefully one day, we will have a giant tree and I can take pictures of them every year by it. And then they can bury me under it. That's what I told them today at dinner. And then it brought up my children were like, they're like, what do you mean bury you under? I was like, when I die. And Piper's like, tomorrow. I was like, wow, that's like really harsh and really soon. And then Avery was like, not tomorrow, probably next week. I was like, what are you not telling me? Chelsea, I get nothing else done. You are a phenomenal mom. I get literally nothing else done. My children eat peanut butter and jelly for almost every single meal during the week. I mean, every day. And there was a long list of things I was supposed to do today. I just did none of them. I needed to go outside. I was feeling sad. I was like, I'm going to go outside. And I'm also not in grad school anymore. And I work part-time. So that is how. I also neglect a lot of duties, a lot of them. And I have horrible time management. I was supposed to go out and mow the yard. So it causes a lot of struggles in my personal life because I have zero ability to focus. And it's not good when you tell your husband, I'm going to go mow the yard. And then you come in 5 hours later and he was like, oh, did you mow the yard? And I'm like, well, no, I did spend 3 hours though cleaning out prickle thorns, which I now need you to remove from my fingers. I also spent an hour looking for a sapling of an oak and then another hour digging it out and replanting it carefully to maintain its root so that we can save the world with our oak tree. So we had that. And we're not really mowing the yard because there is no yard. It's just dirt, but I want to crunch up the leaves. So we have our mower will, it will chop up the leaves. I don't mulch the leaves and then put them in a, like spit it back out on the yard, which I'm hoping will somehow help the yard. But it will be less slippery because right now the leaves are really, really slippery and they'll take a long time to break down. So our soil is really yucky. It's just garbage. It's really like clay. So, I just basically want to mulch the leaves. So I'm not really mowing it. I was just going to kind of like vacuum it, focus, unable. One day, maybe I will medicate myself for the ADHD that is in my brain. But until that day, we won't get there. So we have that. To be honest, enjoy your time with your kids. Before you know it, they'll be grown and gone and you won't know where the time went. I know. I was trying to remind myself that today when they were attached to me as I was ripping thorns out of the ground. I was like, you might want to just be like 5 steps backwards. And then I was like, you're going to get prickled by these prickle thorns. And then they would stay right there. And then they would get prickled by the prickle thorns. And then they were not happy. I was like, why? Why is all of this happening? You want to see, this is how many, let me pull it up, prickle thorns. This was my project that, and the unfortunate part was I admitted it to Instagram what I had done first before I came inside and told Joe. And then he was like, yeah, I already saw it on Instagram. I was like, whoa, oops. This is how many prickle thorns I got. So that basket's like 4 feet tall. Super proud. Just went to town. Everyone was like, why? Every time you say prickle thorns, I think of DIC. Disseminated intravascular coagulation. Till it for better results. We have done that for our yard. So we have aerators. Our neighbor that lives next to us is really good at searching Facebook Marketplace. And so we've all kind of like gone in on Amazon, like Facebook Marketplace yard tools, and then we share it with each other, which is like very economical. And we're here for it. So we have a tiller thing that like puts little tiny holes and like helps chop up the dirt. We're trying. We are trying to do that. And our yard is going to be a long, one day it'll happen. They put all of our grass seeds. So it's a new house. They put all of the grass seeds down in the middle of summer and it just burnt it to a crisp. So then we came through and like tilled it all. And then we put down new grass seed and we're just trying to give it some nutrition back because it's just clay, the poor thing. It's just like, we don't really want yard anyway. I want to like plant a bajillion things in it. So it's like, my little crazy biome. So I can be like the crazy Liz running around on the mountain in my crocheted outfits with my Crocs and my socks. So I don't really care about the grass to be too great, if we're being honest, because I just want to like make it a forest again, but who knows? I do want room for a garden. So I do need to figure out where I'm going to be putting that. Leather gloves are the best to keep out prickles. Yes, I had those. I'm trying to figure, do they make leather gloves so right now, today, my problem was in my paranoia, because of my issues with poison ivy, I have to wear gloves that go up to my like elbow. I couldn't find leather gloves that would go up to my elbow. So I would have other gloves that go up to my elbow, but they are not made of leather. So my little fingies get thorns in them. Let me see. Can you see that one has a thorn in it still? We took out like five of them already. Yeah. I do want a food forest. We've planted like blackberries, we've planted blueberries, and all of that. So we do kind of want like a food forest. We're going to plant like fruit trees over in a grove on the side. I would love that. Love it. Women's Work sells long leather gloves. I'm going to take a picture of that word and then cow insemination gloves. I really should probably honestly look at that. People probably have those in my area. Um, because I live where there's a lot of cows. Um, oh my gosh, I can picture your outfit in the woods. I wish I knew where my picture of my outfit in the woods was. I'll try to find it and I'll bring it on Friday. Um, when we have our next live, because looking for it right now would just be a hot mess. But yes, attention deficit. Ooh, shiny. I love that life too. Yeah, it's a lot. Let me see. Oh my gosh, I need a I picture you in overalls. So I don't have overalls. I very much have though, like most of the time in the wild, I will be found in like right now, long sleeve t-shirt and then like cotton, like some kind of a skirt that has like buttons down the middle, and then like tights and then boots. So I'm rocking like, I don't know, hippie cottage vibe probably. um uh very much that. The mulch leaves will add a ton of nutrition. That's what I'm hoping, Hunter. We've been doing it for years and our soil went from nothing to green grass and gardens. We compost as well. We're composting. I have compost, like little hodgepodgey compost bins and then like piles all over. And then our goal is once we lumber's just like so expensive. Joe's gonna make us a 3 thing compost thing so that we can like really do the composting because we want to do all of that. But that gives me hope that the leaves will add a ton of nutrition. That's what I'm really hoping. I just want to like chop them up and feed them back to the soil. We've been composting or like chopping up. We have a wood chopper that chops up all of our like branches and like little leaves that then we kind of like put back in the garden beds to try to like feed it back. So that's what I do. I can't afford therapy. So I just go out in my garden. Do all of this stuff. And that's how we get along. So, all right, I am going to go and see. I bet my neighbors have a picture of me in my outfit because sometimes my friends just walk by and take pictures of me. I'm like, somewhere there is a somewhere there's a group of people, probably of my friends. I'll get you, my pretty. I feel the septic field will help with this. They just stop by and take pictures. I'm like, you're in a group together, aren't you? Where you just share pictures of like me being crazy up on my mountain, but happy. I go back. No. Oh, this is taking me back to like poison ivy times, which is, oh, I don't like the poison ivy times. There's us. Oh, my arms look so bad. Oh, I think we're approaching maybe when I had it. Let's see. Oh, all the summer. I'm like just casually throwing school my pictures. All is well. Let me see. I don't know if I can find it, guys. This is not what you should be doing on a live stream. How to kill your audience retention in 3, 2, 1. Just go scrolling through your photos that they cannot see. Diatomaceous earth, add it to your mix. Sell the lawnmower. I don't know what that is. I'm going to take a picture of that too. I'm going to take a picture of this and that. Ditch the lawnmower and get some goats to eat the poison ivy and thorny things. I actually looked to see if there were any goats that I could rent locally, and I could not find any. But if you know of any goats, if you know of any goats that I can rent, I will rent. I am not above renting a goat because I think that sounds awesome. I don't want to own the goat because I feel like they'll eat me out of house and home, and I just want to own the alpacas. But I would rent a goat. One of my nursing friends at my first job, she had a goat and they rented them out. They had like a little pack of goats. And they actually just like rented them out to people for that exact purpose. Yeah, we are not finding this. Well, that's a bummer. You can't see my crazy outfit. I should have taken one today. Me and my getup. But anyway, well, that was a pointless search. Thanks for sticking around with me with it. It's like the people of Walmart, Nurse Liz edition. Yes. Sometimes I wear that outfit to Walmart. Joe does not like that. My family does not like to be seen with me when I wear my gardening outfit out in public. It's like, what on earth? Today I learned you can rent a goat. Yes, you rent a little group of them. Usually you rent like a little pack and they come in and they'll eat your poison ivy, which is how I originally looked into it, was because I found out that they could eat my poison ivy. Which I'm just looking at pictures of now. And that was like so bad. There's like weeks of my life I just don't remember because I just had to take Benadryl to become unconscious because it hurt so bad and they didn't know what to do with me. Ugh, that was no fun. But yes, you can rent a little herd of goats. They'll put like a little tiny fence up and they just go and they'll eat your poison ivy. They'll eat all your grass. Llamas are also really good at mowing your lawn. So you can just get some llamas. And yes, we can do yoga with them afterwards, Jamie. Exactly. We can go do some yoga. All is well. Oh, I'm finding the goats will also entertain your small children. My poor small children. My small children might like attack the goats. The poor goats. They don't deserve to have to hang out with my small children, who can be a little bit much. They're a little bit intimidating. Goat, although all-in-one lawnmower fertilizing milk producing machine. Yes, it's true. One day, really should have moved to a farm. But I feel like that would be a little bit more life all encompassing than I have the time for right now. But I feel like the farm life, I could go and be a homesteader, and they add great fertilizer. See, that's why I need chickens too, because I've heard chickens give you great fertilizer with their poops. In case for all you non-country people, we're talking about fertilizing with poops. Oh, here we go. Okay, hang on. I found a picture. I just need. Here we go. Okay. Hang on one second. I found a picture. Long awaited. I want to. It just has my address on it, so I just have to blur that out really quick. Give me 1 second. When are you going to move to your farm? Never. I'm hoping that no one ever moves across the street from me and I can just conquest that land. Take it over. Copy. And then let's share this back because there's no way I'm ever moving again. No, I can't do that. I cannot do that ever again. That was too much. Let's text this. Paste. Perfect. Okay, you can kind of see it. I'm going to pull it from here. This is the longest, most roundabout way I probably could have done this, but it's fine. So this gives you kind of an idea. Let's see. Thanks for waiting. Okay. So that gives you kind of an idea. I did an image background deletion type of thing. But it gives you pretty much the gist. We have the leggings, we have the socks pulled up over the leggings. We have my gardening apron, which flaps down to allow things to fall out. We have the gloves that go up to the elbows, the long sleeve shirt, the hat, and the rainbow Crocs. So that, my friends. But in a pinch, would you deliver baby goats? Yes. Oh, we're all moving around you. We'll start a commune. Perfect. We already have a commune kind of going. So we've got the healthcare people, we have got lots of teachers, we've got a nuclear engineer, a lot of tech people, we have a dentist, we have a vet nurse. So we need a vet. So that's what we got. Please come and add to the commune. We'd love to have you. Definitely missing the bee helmet. Absolutely. We will be adding that. I promise. Take me to your leader. Thank you. That is the vibe I wanted to give off. Outfit is missing a bandana. I will try harder. You're right. A bandana would add to it. 10 points for pockets, 5 more for color choice. Thank you. Thank you. Ah. So this is what you will see me running down the down the hill at you. Keep in mind I'm 5'10". Okay. So this giant human is galloping and I don't have great balance and it's very slippery. So usually there's a lot of this hand movements coming down, being like, oh, hello, both in like a greeting and a I don't want to fall. So just keep all of that in mind. As you observe all of this, very Martian. Yes. Yes. So I go to Walmart in it sometimes. My family's like, why are you going in public like this? I'm like, do you think I'm alone? Like, do you think I'm alone here? No, no. Other people are dressed like this. Oops, wrong thing. I didn't mean to pull that up. Did you know that, yes, I am 5'10"? Everyone's always shocked. They always think I'm much shorter. Dark colors attract hornets and angry bees. Well, that's not good. I'll have to try. That's not good. I'd move there. I'd turn my yard into a giant garden and I would grow food for everyone. That's literally my plan. I'm going to make like a little stall and people can just come and like take food. 5'10". I feel so short. How tall are you, Chad? Yeah, everyone, I am, everyone literally always thinks I'm short. I'm like, I am not. My humans are a little bit. Avery's very petite, so that's going to be really funny. But Piper's going to be giant. But yeah, I forget what I was going to say. Where are we going? Also missing a big bow on the hat. Michaela, the back of the hat has a big bow. It's like right on the back. It's like a huge bow on the back. So I got you. You do need to step up. Your outfit game. I'm a violinist and I can cook. Those are amazing skills. I have neither of those. I do not understand instruments that have strings. I can play woodwinds, but instruments with strings and I can play the piano. I'm like, how? How? I'm 6 feet. Do I win? Yes. 5'7.25". I mean, we can't all be winners, Chad. We can't all be winners. Just kidding. It truly doesn't matter. How tall is Joe? Like 5'10". I'm pretty sure if we really stood up like super straight, I'm probably taller than him. Maybe not. Maybe he slouches a little. I don't know. He doesn't stand up straight, so I usually look taller than him. I think he might technically have like a hair on me. But you know, we got that. OB nurse Chelsea. I would not really be helpful in the commune. False. We always need people who can deliver babies and are very smart and are just generally gems to be around. Asian and 5'7", I win. That's true. SD Beagle. I mean, yes. Yes. My husband is a quarter Japanese. His grandma is Japanese. And his family, it's like very funny when I'm in front of them because his family is just shorter. His grandma's like 4'9", maybe, like very short. And his whole family is just shorter. And then there's me, and my family is gigantic. I am amongst my cousins, like short. They're gigantic. It's very funny. I can also play the piano. Perfect. Glissando girl. Perfect. We can make a little ensemble with our commune. I love it. I love it. Chad and I will share call, I guess. There you go. There are a lot of, there's like 4 pregnant people in our neighborhood right now and a lot more want babies. So like truthfully, we probably need to, midwives, like in all seriousness. There's a lot. Also, if one of you could like dabble in animal husbandry or like delivering the animals, that would be great. Yes. That way one of us can always be ready to party. That's perfect because we do that a lot here. It is we have a corner that we all kind of gather at in our neighborhood and we just hang out. So it's perfect. Stephanie Pajari plays flute and tuba. That is a phenomenal combination. I play the flute, but not the tuba. And I have massive respect for people who do. Vocal performance minor. Here. Cheers. You're hired. You can come. Sophia, you can move in. Scott's moving in because Scott plays has his instruments, and is just generally a good time and makes really good advertisements for airline companies. So he's allowed in. I do need something reflective to add to the outfit. I will think about that. I will try to figure that out. Love cello. Cello is very impressive. Do you play the cello? Cello and singing here. Mel can come. We'll take Mel. I love the commune idea. I get to live a simple life with some of my favorite people. Sounds like a win to me. It's perfect. Seriously. I'm like, whenever my friends, like, we all talk about making like just in a closed commune, I'm like, there's a large part of me that's like, but really, guys, like, really, but really, can we actually do this? Please. Scott plays the saxophone, the clarinet, the recorder, the flute, and strings are hard. And I'm 6'3". Okay. So there you go. Wow, Scott, you're tall. Dang. Okay. So Scott's really tall. He wins in our group. We'll have to see how tall the other members are, but I think 6'3" probably wins. That's like how tall most of my cousins are. They're like 6'3", 6'4", 6'5". They're all hanging out up there. I have no idea where we're going, but it sounds good. It does sound good. You just say yes. Just say yes. I'm also down to learn new skills. Perfect. We need a lawyer. We are very much lacking a lawyer in our neighborhood. So if you could brush up on lawyer type things, that would be phenomenal. What else do we need? We also need a mechanic for like Joe's kind of the unofficial mechanic. He'll go over and help people fix their lawnmowers. So you could kind of dabble in that. It would allow him to focus on some of the things we need done around our house more. We really, oh my goodness, we need an electrician. Holy moly, do we need an electrician? So Naralia, those are some of your choices to kind of just like look into, start dabbling, see if you like any of those. There we go. We do need another content creator, Michaela. Perfect. Because I am slacking on that game, even though it is technically my job. I'm really bad at it. So if you could come and help me, like by giving our commune like more of a presence, that would be perfect because I'm doing a bad job at it. My sister can come. She sews and knits and cooks and bakes too. Is there room for both of us? Yes, I've told you many times you can just come and be we'll build you a room in the basement. You can just come and be our little house elf. All will be fine. You'll have your whole own basement. I can make our crochet outfits. Guys, this is going to be great. We are here. Do we need a corrections nurse? Because I've got that covered. Probably. We probably will get to the point where we do. Give it we don't have too many teenagers yet, but I feel like you could really do a good job scaring them in a few years when they get to that prime time when we need that. So you can spend a few years building a jail. We have a old barn on one of the lots that's just abandoned. So maybe you could turn that into the jail. So work on that. And we will figure it out. At some point I will need to be locked up. So we will need the corrections first. Perfect. I think all of us, if we're being honest, will probably spend a few nights in that jail. So here we are. My 9-year-old needs to be scared straight. Chelsea, just drop her off. It's totally fine. Or him. Yes. I messed up with electricity once and I almost needed a nurse. Funny story. When I was pregnant with Avery, we were replacing a chandelier like above our kitchen table in our house. And our house in Michigan was built in like the late 1950s. And no one ever removed wires from it. They just seemed to add them. So we took off this chandelier that looked like it was like a weapon from Star Trek. Like it just had a bunch of weird metal angles coming out of it, but it was also spacey. So we lived with it for a long time and then we decided we were going to change it ourselves because once again, we couldn't afford an electrician. And you can YouTube anything. This is fine. We'll just install a new thing. So we took it down. Joe took it down. I didn't do any of this. Joe took it down and like all these wires came out of the ceiling from the last 70 years that this house had existed. And we go and Joe gets everything hooked up. He's really good at this type of thing now, but this is a long time ago now. And He had not done many of these things. And we go and hook the new thing up, and he tells me, hey, he goes into the basement and he's like, hey, like, I'm going to turn the circuit breaker on. You flip the switch and you tell me if the light comes on, if we've successfully hooked this thing up. Sounds like a shocking experience. Yes. Um, so he turns the switch breaker on, gives it power back. I hit the switch. I hit the switch, which when I did that, I got electrocuted. And the power to half of our house turned off. So we had no power. It was like the middle of winter. We were terrified to admit our mistake because to anyone else, we were like, how am I going to explain this to like my parents if we need to go? Because they lived like a mile away. I was like, I don't want to explain to them that, that I did this or that we did this. Eventually, a few hours later, Joe did get the power back on. And that was not a fun phone call that I got to make to my midwife. Avery was kicking. She was totally fine. She was very much kicking and very active. But I did have to go in to triage and we did a non-stress test and all of that. I don't even remember else what I did. But that was not a fun call to have to make to be like, I am a little bit electrocuted. I do have a little bit of a burn where it entered my fingers. She's jolted awake. So yeah, Avery was definitely awake now. So that happened. And yes, when I was pregnant with Avery was also when I decided to remodel my bathroom. By once again, I was earlier pregnant with Avery when I remodeled the bathroom. The lighting fixture was a lot later on. When I was pregnant with Avery, I was so nauseous. I had hyperemesis and I had a break from grad school and I was so sick of throwing up constantly that on like one of my better, like a day when I could actually like finally like I stopped throwing up constantly at like 26 weeks and then I would throw up like twice a day, but it became predictable. So I don't know if that's technically hyperemesis because it did eventually stop and then it was just twice a day. I knew when I was going to puke, but I felt like a new woman when I stopped puking 100% of the time. So I one day I was like, our bathroom is ugly. And Joe was like, oh, that's fine. Like we can definitely like we were going to tear out some of the tile, like, cause it was already falling off. We're like, oh, let's tear off the tile and we'll just like retile this one little bit. So he's at work and I start tearing off the tile. And of course, you know what happens when you start tearing off the tile, some of this drywall comes with it. He comes home from work. So I was like, I'm just going to keep tearing this down because like little bits of it are coming down. Keep in mind, we've never done anything like home improvement-y. By the time he got home from work, I had the entire bathroom down to studs. I went out, got a sledgehammer. I was like, well, we're just going to tear this bathroom down. Cause then I started like looking back and I was like, I don't think they actually sealed cause someone had like redone it some sort of within the last decade and they hadn't done a good job. So it wasn't like actually waterproof. And I was like, oh, there's water getting behind here. We can't have mold with a baby. So, which was good and logical. A more logical step would have been like, maybe wait, because this is our only bathroom in the house. I forgot to mention that. So just took it down to studs, which is a bold thing to do when you are pregnant and you have never done any remodeling before. But through the power of YouTube, we went and got gym membership and showered at the gym. And here we are. So that's where we are. We almost got, Risa Doobie said, home improvement projects can be stressful. We almost got divorced over ground molding dispute years back. I understand that. The angles involved in molding have been almost marriage ending. This sounds like how I start projects, ignoring that part and completing the projects. Yes, we did have to complete it. But yes, most projects in life I don't complete. I just start. But this one we did have to since we had no other bathroom. And it looked great. It really did look great. And we ended up selling our house for a lot more money. And one of the selling points was the bathroom. So, all in all, I really liked being able to look back at that and be like, look, we YouTubed our way through a bathroom that is now a lot more waterproof than it once was. Could the timing have been better? Yes. Would we have ever had time to do it afterwards? No, because then we had children. Would we have been able to afford it? No. So, really, I was just helping us. And I am a mess. We should all just appreciate Joe for not leaving me. The amount of times I have done something like that are astounding. And every time I come up with a new ADHD hobby, he's just like, okay, Liz. Okay. You want to go out in the woods for 4 hours and tear down the prickle thorns and plant a forest to save the world? Okay, Liz. That's fine. My grandpa has earned a master's at YouTube University. It was very cost effective school as well. Yeah, that's how most of us get through school anyway, in nursing and NP school. So it's fine. Yes, I did take nursing and nesting to the extreme, and it was fine. Everything's fine. Everything is YouTubeable. Everything, you can always look everything up. Arisa said, along with these lines, my master bath has been out of commission for 1 year. And on Sunday, I finally got to a new shower and it was worth the wait. Oh my gosh, that's amazing. Amazing. Congratulations. I'm very glad for you. Another commune advantage equals shared supplies for fleeting new project inspiration. Yes. All the ADHD hobbyers, we can just like kind of shift it off and be like, oh, you're very into quilting? That was 2013, Liz. Please pause. I'll get you all of my supplies. Why, yes, I would love, love, love to dive into your macrame hobby. Please show me. So this will be perfect. All right, friends. Well, I am going to go off to bed because my phone just told me that it's my bedtime. So I best believe it. Thanks for hanging out. Thanks for letting us rant and then chat. You're the best group of people on the internet, and I very much appreciate you. If you did like this, make sure to like the video. It tells the YouTube gods that you enjoyed it, and it saves the video when you do an odd number of compressions on it. And yes, I will see you Friday for our panel discussion. I will find that link for you somewhere. Oh yeah, to the billing and coding thing. I was like, what were we linking? And I will put it in the description. This was fun. Thanks for hanging out. I liked how I liked our hard pivot to the right. It was a lot more entertaining at the end. How many commune members are we doing? I don't know. How large do we want our commune to be? What are we going to call it? These are all questions that I feel we should ponder and come and convene back on Friday when we have our group discussion on the topic that I will think of by the time it is Friday. Anyway, thanks for being here, friends. I very much appreciate you. Please do always remember that you are not alone. You are more than enough, and you can do hard things like rebuilding a bathroom from studs. You can do it. I know you can, or going to the healthcare provider and advocating that you don't have to pay extra for all the other junk. Ready? Okay, great. Bye. Bye, friends.